Major update today on plans for a second drug injecting room in the Melbourne CBD, as recommended in a report from former Police Commissioner Ken Lay, but belatedly released this week after more than a year.
We have been unable to find a location that strikes the right balance between supporting people who use drugs with the needs of the broader community. And that is why a second injecting service in the CBD is not our plan and it won't be proceeding.
All right, let's pull apart the spin for some substance now. I'm joined by Victorian Shadow Minister for Health Georgie Crozier. Georgie, this report from Ken Lay took 10 years to turn up with the government. Close to $400,000 was spent. The number one recommendation was for a second injecting room, this time in the Melbourne CBD. Do you agree with it being axed?
Well, Peter, as you said, Ken Lay was commissioned 4 years ago to look into this issue around a second injecting room into the CBD. We've always opposed an injecting room to be in the CBD, and 4 years later, the government has finally come out and said there won't be one to proceed. But it doesn't take away from the fact that it's a long overdue decision that I'm sure the residents and businesses will welcome. But it doesn't take away from the fact that the government has been failing in delivering real meaningful drug and rehabilitation services in Victoria.
I've got a question, Georgie, you've got a long history here about whether we can trust the Labor government, because they said before an election that they'd never have a drug injecting room in Victoria. They did not support one. Straight after they won the election, they started a trial, they call it, and then that trial became the permanent facility in Richmond. The Victorian Mental Health Minister, and she will have carriage of this new facility they're going to build down there. They're saying it's not an injecting room, it's a health centre. Her name's Ingrid Stitt. Well, she was on radio this afternoon on 3AW. She was asked about a hydromorphone. This is a replacement for heroin. She asked questions about that. Would it be injected in this new health hub? And here's the response.
Yes, it will be medically supervised and it is injected. There are some oral supplements that are taken as part of these sorts of trials. But as I said, it is a Victoria first.
So my fear here, Georgie, I mean, this will be injecting drugs. Yes, there'll be government doctors prescribed drugs, not illicit drugs, but they'll still be, mind-altering drugs. This will be a drug injecting room by stealth. I bet you we all accept it won't happen. They'll start this, it'll be a trial, and we'll go down the path of what happened in Richmond. Are they softening us up, or do you really believe there will not be one in the CBD?
No, you've got every right to be cynical, Peter. I mean, as you said, they said no injecting room, and then we've got an injecting room. They said no ice in the injecting room, and we've got ice in the North Richmond injecting room. And quite frankly, the residents of North Richmond should be really furious that the Premier came out and said the community didn't want it in the CBD. Well, those residents don't want that injecting room next to a primary school either. So you've got every right to be cynical about the government's motives. Can I just say a bit about hydromorphone? It was actually our policy also to not only increase the numbers of rehabilitation beds across the state. We're way behind New South Wales. We said we needed 180 rehabilitation and treatment beds, withdrawal beds across the state. But hydromorphone is a last line treatment when methadone fails. And we suggested in the lead up to the last election that it be very heavily supervised co-located in a hospital where you've got medical supervision, and I mean it's a TGA approved drug, so it can be prescribed, but it needs to be carefully supervised. And I'm concerned about how the government will roll out their program in Flinders Street at the Uralla building that they bought for $40-odd million. So I think you've got every right to be cynical about what's going to proceed here. And of course, there are obviously businesses and residents are welcoming the announcement, but there is still concern around what the government will proceed with down the track.
Devil's in the detail, and of course there's an election for the Melbourne City Council, and I sort of worry that this is done deliberately to assist those running for the council elections, and they'll do whatever they like afterwards. Georgie Crozier, thanks as always. Great to have your company.